Think Health.
Did you know that last year over 150,000 people underwent eyelid surgery to improve their appearance or visual fields? That makes it the third most common cosmetic procedure. Hi, my name is Dr. Paul Vanek, and I'm a double board certified plastic surgeon. Welcome to Think Health. I'd like to explore with you how you can combat the changes that occur from four basic forces that cause our upper lids to appear tired and droopy, namely our genetics, our sun damage, our general health, and environmental stresses like smoking. These factors can combine to make us look older or more tired or unapproachable than we feel. Plastic surgeons separate the problems of the aging upper face into components that include the brow, the upper lid, and the lower eyelid, and then figure out what concerns you most. Think of the normal upper eyelid as a window shade with a spring at the top called the levator muscle. The shade is what the fascia is connected to, and the fascia is like then connected to like a stick in the bottom that the lid margin is actually made of cartilage. With this analogy comes the idea that the skin can become very loose from sun damage or smoking or how you pick your parents. Also, the fat pads above the eyelid can droop and weigh down the lid. Sometimes there are problems with the elevator muscle function, and sometimes the window shade gets too long or gets detached from the stick on the bottom. The lower eyelid is like a hammock, and the ligament and muscle has a three-dimensional eyelid that has a layer that holds the fat pads back around the eyeball like a retaining wall. The muscle is a circle around the lid that gets more lax as we age, and the skin is the most loose tissue layer subject to the forces of gravity and sun damage as we age. The retaining wall gets lax and the fat pads protrude. The hammock sometimes gets lax and needs tightening, so the muscle laxity and the tired appearance improves by surgically tightening it up and removing some fat conservatively and repositioning it. The loose extra skin is also removed after the lid margin is restored to its youthful position. This sometimes needs an incision at the base of the eyelash line where the lid meets the eyelashes. The scar is barely perceptible, and the surgery can be done with you awake or sedated, depending on your temperament. The improvement of your appearance is dramatic. Well-rested, relaxed, and natural are the common views of the patient who choose to have their eyelids surgically rejuvenated. I'm here with my patient, Kathy South. She's here 1 year after having decided to undertake some facial rejuvenation with my practice, which included, of course, some upper and lower eyelid surgery. Welcome to Think Health, Kathy.
Thank you.
Kathy's a teacher, and how do you feel, how did you decide before your surgery that you were actually going to do your facial rejuvenation with eyelid surgery?
Well, when I went through menopause, I started to notice a dramatic change in my face. As I looked into the mirror, I thought, who is that old person looking back at me? And you had an ad in the paper for Botox, and I came into your office, and you made me feel so comfortable, relaxed. I tried it, and when I talked with you, you went over different things with me I could do to look better, and I just decided to go with you, to take a chance at it. Yeah.
Well, now that you're 1 year post-op, how do you feel about your results?
I love it, and I think the best compliment came from a friend of mine who hadn't seen me for 6 months, and she said, "You look just like you, but younger."
Oh, that's great, Kathy.
Yeah.
Well, like any surgery, it comes with risks of scarring, an unnatural appearance, and delays in healing. Patients with a dry eye condition or cornea problem should be especially cautious if contemplating eyelid surgery. For more information on eyelid surgery, click onto my website, paulvanekmd.com. The eyes are the window to the soul, and they reflect our energy, passion, admiration, and openness to the world. If you're tired of being asked if you slept okay last night, or aren't you feeling well, and would you like to look younger, more rested, and more approachable, then eyelid surgery might be for you. Until next week, I hope this helps you think health.
Think Health.